Hello and welcome to an all-new episode of Hatching for Health, where our mission is to create a platform for people to tell their story, to educate the public, and to build a more compassionate community. And I'm your host, Jessica Hatch. Today we're joined by optometrist Dr. David Way from MyEyeDr to explore the importance of eye health and how clear vision can truly change lives. Dr. Way is here with us and two of his patients. We have Maria and Stephen, who will share how their lives were transformed after years of struggling with unclear vision. Welcome to the show.
Thank you, Jessica. Good morning, and I'm really excited to be here, so thank you.
I know, we are very excited to have you. You're the first optometrist we've actually had on the show.
Wonderful.
So I think it's great to kind of explore the understanding of that field.
Great, I'm happy to be here for that.
And what all you do. So tell me a little bit about just like your background and the passion you have for your practice.
So I knew pretty much from an early age that I wanted to be a doctor, but I wasn't quite sure what specialty or what type of doctor, and started doing a lot of volunteering at hospitals, volunteering in different type of medical specialties just to get a feel for different types of doctors. And then early in my college, first couple of years of college, I was introduced to a friend of a friend who was an optometrist. He became kind of my first mentor, and he was the one who pretty much after about an hour of conversation convinced me that this was what I wanted to do. So yeah, I like to solve problems. I really love helping patients. It's, you know, one of the giftings God has given me is service to people, and so I really like to use that, and this just fits perfectly well.
That is fantastic. So what does that degree look like, you know, the medical, you know, training and all the things that lead up to that role? So
what optometrists do is they go to 4 years of undergraduate and then 4 years of optometry school, which specializes from day one in the eye care and vision. The main difference between an optometrist and an ophthalmologist would be an ophthalmologist goes to 4 years of undergraduate, then 4 years of general medical school, and then they spend another 3 to maybe 5 years specializing in the eye. For me, I thought about that, but it just felt like that was going to be a little bit longer road than I wanted to go through, and was ready to kind of start life.
And get your hands on helping.
And really wasn't as interested in doing surgery as I was in just patient care and being with patients and talking with them and becoming friends with them. So optometry seemed to fit me better.
Okay, and was that schooling done here in Texas or Houston?
It was, yes. So I did my undergraduate study at University of St. Thomas, which is here in Houston.
Yeah, lovely.
And then after that went to University of Houston College of Optometry, which at the time was the only optometry school in Texas, but now we actually have two. There's another one in San Antonio now. So
really? So there's only the two?
Yes, yeah.
So it's like most everybody you meet around here has gone to one or the other.
Yes, typically speaking, most patients or most doctors in Texas have gone to one of the other two, yeah.
So I've seen the MyEyeDr, I feel like quite a few places.
Yeah.
But is it a franchise or is it something that you started, or how did that come about?
So no, what MyEyeDr is, it started a little over 20 years ago in the East Coast, and what their goal was to partner with private practices. So not to be a corporation that sets up shop and brings a doctor in, but actually to partner with doctors who had already had established practices. And so the benefit of that is you have a doctor who's used to privately practicing and taking care of patients the way they do, and then MyEyeDr merges with that private practice, and at that point they take over kind of the business aspects of it, ordering frames, making sure there's contact lenses, you know, advertising to patients, taking care of employee things. And that's a great relief to doctors because doctor school doesn't train you very well how to run a business effectively. Most of us get into it to take care of patients, not really to run the business.
Exactly.
And so it makes for a very good partnership, actually.
That is great. And so how long were you like in private practice, independent of them, before you merged? So
I founded a practice with a friend right after school in 2003 up in Spring, Texas, and ran that kind of by myself, had partner doctor who's been great, but I was kind of in charge of the business aspect of it for about 18 years. And then that's kind of when the pandemic hit around 2020 and took my stress level to a whole nother place. And I just got to the point where I really wasn't enjoying being there because of all the businessy stuff. I was devoting just as much time to managing the practice and all the aspects of the business as I was getting to help patients, and it was causing me not to be able to spend time learning new technologies and new techniques to help patients see better. And so MyEyeDr came in at a perfect time for me.
It sounds like it.
Merged with me and took my stress level to an all new low, which has been great.
Yeah, that is great. And so your location, where is it located?
My location is in the Spring Klein area. So it's up in Spring on FM 2920, kind of in the Klein ISD school district. Thankfully, though, we have 27 locations all throughout the greater Houston area. So there's definitely a location close to any viewer here.
Okay, so they do obviously, as far as a certain mile radius, like they don't, try and find other practices too close. Like there's a distance between each of you.
Correct. Yeah. I mean, it's rare that you would have two practices within 5 to 7 miles of each other. They're my eye doctor locations. Yeah.
Kind of handling each little
right
geographic area. You talked about Klein area, so I learned that you were with Klein ISD. You had you were part of a vision outreach program. Tell me about that.
So I grew up in Klein ISD. My wife and I both graduated from Klein Forest High School back in the day. That's where we met. And I just have always felt a desire to give back to the district that did so well for me. And so when I got out of school, of course, early on in practice, I didn't have a ton of patients coming in the door. It takes time to build up a good patient base. And so I decided that the best opportunity for me would be to call up the district head nurse and offer my services. And they said, well, we really don't need help with vision screenings. What we need is some free eye exams for some of our children. And I said, fantastic, let's do that. And so over the years, I then partnered with the Essilor Vision Foundation, which is Essilor is a lens manufacturer that has a vision foundation that allows a doctor to adopt a Title I school, which is a school where more than, I believe, 50% of their students are on reduced or free lunches. And Klein ISD unfortunately has a whole section in the south side of it that most of the schools in that area qualify as that. And so they don't have a lot of opportunities to get good health care and good eye care for their children. And
that sounds like a wonderful program.
It was, yeah.
So you were able to be a part of that program and help?
Yes, so I did that for probably 10 or 12 years with Klein ISD, partnered with them, and we would on average see between 80 and 120 students each year, kind of just after their vision screenings would happen.
That's amazing.
Yeah, we would go in, I would do an eye exam. My partner, Dr. Lauren Nelson, would come and help me with those. She's been fantastic with that. And offer the prescriptions, and then at that point we would send the prescriptions to Essilor and they would make the glasses for free for the children. And then I would take the glasses back to the school nurses and they would dispense them to the kids. So it was kind of life-changing for a lot of the kids.
I know that, and all because you decided to reach out to help. It turned into this, for a lot of people, game changer for the children and those opportunities. So going back to your practice, what all unique testing do you guys offer?
We offer a little bit of everything. So we kind of want to be a one-stop shop for eyes and vision care. I treat everything from glasses and contact lenses to glaucoma. We do diabetes eye care. We do cataract co-management with our cataract surgeons. So at all of the MyEyeDr locations, including our own, we have the latest technology. So visual field testing to make sure you haven't lost any of your peripheral vision. We also have OptoMap retinal imaging, which allows us to pinpoint things like diabetes in the eye, hypertension in the eye.
It's so much more advanced.
It is way more advanced than it ever was before.
Is the keratoconus, tell me about that, is that also
It is, yeah. So keratoconus is a disease of the cornea. So the white part of the eye is the sclera, and then the iris, of course, is the colored part of the eye. In front of the iris is a dome-shaped or rounded tissue called the cornea. It's where you get the little gleam or reflection in somebody's eye. And most of those patients, or most normal patients, have a dome-shaped or rounded cornea. And so the purpose of that is when light hits the cornea, it bends it perfectly into the eye to focus on the retina so you can see clearly. And so in keratoconus, what happens is the structural layer, the center layer of the cornea, those are collagen keratin fibers, they start to break down and lose their elasticity over time. It's a genetic condition that can happen.
Oh, I see.
And so then the cornea actually tends to fall forward into a cone shape. So the word keratoconus means cornea cone forming. And so that's what happens with those patients. And it causes significant scatter of light. Even with glasses and normal contact lenses, patients with keratoconus can't see well. And so they feel like they're looking without glasses, even with their glasses.
My goodness, that's really difficult. I know we even have two patients here today that are going to kind of talk a little bit about their experience with you and the benefits it's had. So let's now bring out Maria Fernandez, a longtime patient and friend of Dr. Way. After years of bouncing between providers and feeling like just another number, Maria finally found the attentive personalized care that she needed with MyEyeDr. Dr. Way took the time to listen, answer every question, and guide her to the right contact lenses, bringing clarity and confidence back into her life. So Marie, we're so glad you're here with us today.
Thank you, Jessica. Nice to be here.
Yeah, so what a lovely doctor. I can see why there's a great friendship there too.
He's an amazing friend and he's an amazing doctor.
Thank you.
That is great to hear. So I want to know a little bit about your background and your profession.
Okay, so I originate from Mexico City, and when we moved here to the States, you know, that whole insurance thing is different, and you have to go to a specific doctor and referrals and so and so. And that was when I was bounced around, because keratoconus is a very specific disease on the eye, or very specific mutation, I think.
Of course. So you're actually the patient that has this or had this, or
yes,
kind of working
I still
through
have
it.
it.
Right. It's like something that you're treating. Okay.
So it was hard to find somebody that will actually know what they're talking about, right? In Mexico, I had a great doctor that knew about keratoconus, but going around here, it bounced me a lot. And then I found Dr. Way as a friend first. I know I'm a very difficult patient. I know it. I know that I'm very specific. I need extra time. I have a lot of questions.
Yeah.
And as I said, I come from another country where things work differently, right? So after almost 8 months of being friends and finally having him like me as a friend, I decided to go to his practice, and I said, I'm a very difficult patient. I show up to his office with a little sticker to put on my file that said difficult patient. Because I know I am.
Yeah.
And his staff is wonderful. They put the time, they explain you, they give you patience. Since I'm a, you know, I get, putting these contact lenses for me takes a while, because they're not regular contact lenses that you can just put in. They have to be filled with a solution. My eyes are not that big either, so I have to like open them. And so it's been one of these journeys that I'm so happy I found a friend that bring me about
that can
back
actually.
my eyes. Yes.
So when you were in Mexico, did you actually have access to those contacts there, since they understood the disease?
When I was in Mexico, the doctor I had was one of the first ones to introduce the LASIK system.
Okay.
So he knew about it, and there was not, at the moment, there were only like the rings that we'll put on your cornea.
Okay.
And the contacts were just kind of experimental at the moment, but I used to wear glasses that will help me out with it. And that was in my 20s, 30s. And the progression of the disease at that moment, they told us it was like from the 20s all the way to your late 30s.
Okay.
So I but I moved here when I was in my 30s. So that's when all the bouncing started. And
I see. And so were these other doctors just not familiar with that? Like, I guess, is it called a condition or a disease, essentially, because you kind of have to live with it and figure out what the treatment is? But is it just they don't have the familiarity with it, like the way
I think one of them had the familiarity, but his practice was crazy. I was there for 3 hours waiting to be, called in, and then was like, no, I'm not doing this anymore. So I mostly got given up on seeing. We always joke with David that my next graduation would be a dog and a cane, because I couldn't see anything if the contacts didn't work. My husband always jokes that whenever I see somebody, my cornea is dropping, but the bottom of my cornea is fine. So if I try to recognize somebody, I'll go like this, right? It's like he always jokes, people are gonna think you're up, like all like upset. And I'm like, no, it's just that I don't see. And people would say hi for me from far. I couldn't.
It looks like very snooty. You're like,
I'm like, no, I'm not snooty. It's just that I cannot see. And then, seeing people from afar. Getting to recognize my kids from afar.
Yeah.
I'm a travel agent, so sitting on a computer and cutting through the clutter from my clients, and then suddenly being on all time on the screen, it would give me a headache. The contacts help with that as well.
Of
so
course.
It's been a significantly life improvement for me.
We do have to take a commercial break, but I want to come back to some of those symptoms you're talking about, so others that might be experiencing them can maybe lead their way to Dr. Way. But before we head to commercial break, we want to take a moment to honor someone very special to our Hatching for Health family. One of our previous guests, Savannah Ayers, who bravely fought a form of cancer known as osteosarcoma, passed away peacefully at her home with her family this past week. She was a young girl with a light that touched everyone who she met, a light that will never be forgotten. And in her memory, we just want to take a moment and have you join us for a moment of silence. Thank you, Savannah. You will always be remembered.
Your private practice deserves more than sticky notes and missed calls. Funnelcake MD is the HIPAA-compliant growth platform built for doctors and dentists. Manage calls, texts, and emails in one secure inbox. Book more patients, cut the admin chaos, and keep your front desk sane. Try it free for 14 days with full white glove onboarding so you're running smooth from day one. Don't let outdated software hold you back. Sweeten your growth with Funnelcake MD. Start your free trial now at funnelcakemd.ai.
Funnelcake MD, all-in-one tool to grow your practice.
I was recently involved in an 18-wheeler accident. The insurance company was only offering me $1,000. I called Tom Thurlow, and he was able to win me a settlement of $245,000.
Don't delay. Call Tom today. 713-CALL-TOM.
Welcome back from the break. If you've just joined us, we are here talking with Dr. David Way from MyEyeDr to learn about the clinic and the patients he has helped along the way. Along the way, there you go. It's like a perfect little segue. So Maria, we were talking about this condition that you have, and you've had so much trouble finding the right doctor until you came to Dr. Way, known as keratoconus. Am I pronouncing it right?
Keratoconus, yes.
Okay.
Keratoconus, yeah.
Y'all said it much better. We'll leave it there.
Well, we've been living with that for
right. Yeah. So you're like, say it all the time. So, okay. So tell me, this treatment of this, it's a certain contact, or Dr. Way, maybe you can chime in on exactly what that contact is and why it was hard to find.
Yeah, so the contact lenses that we use, there's a couple of different types that we can use in keratoconus. For patients with very mild keratoconus, we can still fit standard soft contact lenses on occasion, but most patients need something that, because the cornea is misshapen, it doesn't have a normal round shape, we need a lens that will actually vault over those irregularities and allow the solution that Maria mentioned earlier to fill in the space. And that resets the front of the eye as a perfectly round, smooth, refracting surface. And so the type that we first tried on her is the type that our second guest is currently wearing successfully, and it's the type that most of my keratoconus patients wear. It's called a scleral lens because it fits on the sclera, the white part, and then vaults over the front of the eye. In Maria's case, we tried that a few times and it just never was quite comfortable. We just couldn't get the right fit.
It's larger, it sounds like.
It's like a large hard contact
white
lens, but oddly enough, it's very comfortable, and our next guest will tell you all about that.
Yeah.
But we have Maria in a lens called the Synergize Hybrid Lens. So it is the old standard hard small contact lens with a soft contact lens attached around the side of it. So it fits and feels like a soft contact lens, but it has the vision aspects of a hard contact lens to fix the keratoconus.
And are you wearing them today?
Yes, I am.
Okay.
I don't see anything.
If you don't have them on.
Yeah. Okay.
Yeah, no, it's and you'd never know that it's like such a different type of contact sitting in the eye either.
Yeah.
So no, that's wonderful. And I know the other patient who we're about to bring on, this is a same condition that he has.
Yes.
So it sounds like it's a little more common than I'm familiar with for sure.
Yeah.
So I know we have another patient here, Stephen, that we're going to talk to you about this same condition. But it was such a pleasure having you on and learning about your experience with his clinic.
Yes.
So thank you for being here.
Thank you.
So now let's hear from Stephen Standefer, who is also here with us in the studio. He has spent nearly 20 years battling blurred vision, and at one point was even wearing 4 contact lenses just to get through the day. As an active coach and a dedicated vice principal working with youth, this struggle impacted every aspect of his life. Everything changed when he met Dr. Way, and today he's here with us to share his dramatic difference and how he has been. So Stephen, welcome to the show. Well, Steve, welcome to the show.
Thank you. Thank you for having me.
Yeah, so I'm learning a lot about this condition that I didn't know existed, but it sounds like it can really put a damper in one's life until you find the right resources.
Seeing is a good thing.
Yeah.
It really is.
Right. So, and you're a principal, you're a coach. So tell me, how did you become a coach first or a principal? Or?
I started out coaching. I was coaching and teaching. I was obviously in the state of Texas. Texas high school football is amazing, and you know, of course, you got to be able to see all the plays from everything from the very beginning. And then after about a 20 years span of coaching, I decided to go into administration and became an assistant principal, and have been doing that for quite a while. I've had the second largest junior high school in the state of Texas. So
what school is that?
That's York Junior High School.
Okay.
Yeah,
That's really exciting. So now you are just president and not doing the coaching, or do you still do both?
No, I do. Well, I do coaching on the side. I'm also a cheerleading coach, believe it or not. So actually, I coach at Woodlands Elite. I do partner stunt coaching, and it's something that's a passion that I had from college. So I did that in college. It was fun. Yeah.
Yeah, and you definitely need to see what's going on with it.
Yeah, I have to be able to see. Yeah,
you're doing stunts and stuff.
Catching a body is really good. You got to, when you throw them, you have to catch them. So you don't want your partner to fall. So seeing is a good thing as well.
Yeah.
It much more crisp now than it was in the past.
Right. So, like, how long does your the eyesight date back where you realized you had issues?
That goes back almost 30 years. So roughly, I started seeing all the markers probably 28, 29. I started noticing my eyesight started going south, and so it was really one of those things. And I met up with went to the optometrist, and my eye doctor was there, and I was like, okay, having these issues, and so he put me in glasses. Still couldn't see real well.
Right.
And then he said, and then I discovered it was being told to me that it was astigmatism at the time.
Okay.
And they were recognizing all the markers for astigmatism. So I finally found out that they had contact lenses for astigmatism. So I said, can I wear those? Because I did not like glasses. Did not like the concept. Corrective lenses just threw me for a loop. I just didn't like them. And so I had a hard time adjusting to those. Put contacts in, got used to them very well.
Yeah.
Still had vision problems, and just it never was right. And then as it continued to progress in every annual exam, I noticed that my eyesight was getting a little difficult to see a little bit more. And my eye doctor at the time said, I'd like to put you in the hard contact lens. So I put the hard contact lens, and it made an amazing difference to see. However, it was so small on my eye that being out in the football field or being on a baseball field or being out just active doing the yard, whatever, I'd get abrasions on my eyes from those lenses shifting across the cornea. And then he said, you've got all the characteristics of keratoconus. And he said, what I would like to do is put you in the hard contact lens and keep it so it keeps its shape. Well, then with the abrasions, he said, I want to put what we call a piggyback. We're going to put a soft contact lens on your eye, and then you put your hard contact lens on it. He said it would allow it to shift. So every day I went through the process of putting in 4 contacts. I put in 2 softs and put in 2 hards,
and
then
wild
lived through that.
Yeah.
Is this common, Dr. Way, that these become
15 to 20 years ago, that was the best option we had. And so it's only been in the last 15 years that the synergized lens came out that Maria wears. And then shortly after that, we had this scleral lens that Steve wears that
so it's
that
been
fits
out
better.
for how long? It's not.
Well, I mean, the technology's been around for a while, but the popularity of them has really grown in the last 5 to 7 years. And so, and you do have to do some special training classes in order to fit these lenses properly. And honestly, you just have to do it a lot to get the experience. So I think what holds a lot of our colleagues back from fitting them is just the anxiety of learning this new technique and spending the time to do it, and then having the opportunity to do it a lot. If you don't practice it a lot, it's hard to do well and efficiently. And so, yeah.
No, of course. So, so bring you back. So you're putting in 4 contacts.
Putting in 4 contacts every day. And my current eye doctor, when I moved from East Texas down to the Houston area, we moved to the Woodlands, and he said, my eye doctor at the time had an associate from school, and he said, I've got a guy for you that'll be good to do that. They went through the same practice and said, you're doing well with piggybacks, let's stay with piggybacks for a while. Then at one point, my current eye doctor was there, and he said, I really want to put you in scleral lenses. However, we don't specialize in them. And so, but it's the typical scenario is I know a guy, so it was great because he said, I want to refer you to Dr. Way. And that was finally, because I was seeing things, but it just never was right. I could see everything, but it was just not right. Then, of course, we all typically want to run to Google MD and researching. And as an educator, I wanted to always, research what I was about to do, because the concept of doing a surgery on my eye was a little scary. And I thought, I don't mind the lenses, but everything, whether it was the algorithm that was putting that hey, do it on one shoulder was there, you always felt like it was there. It was always like the pros were outweighing the cons of the scleral lenses, and had been mentioned the scleral lens. I was like, okay. And I'd heard about the hybrid lens, but my eye doctor, even back in Tyler, said, I don't believe that this would be a good lens for you because you're so rough on your eyes. You'll tear them up constantly. You'll be constantly replacing them. So, the big hard lens, and I always thought that'd be cool if we could put a big hard lens on my eye, you know, because I like the hard lenses.
Yeah.
Because they were so crisp and so clear. And it was funny that whenever I put the hard contact lenses in the first time, I thought, you're not as good looking as you thought you were. Because you could see everything and it was crystal clear. But whenever I met Dr. Way and was introduced to him, we went through all the processes, and of course I did my research, and I said the pros were outweighing the cons big time, and I was all about it, and learning how to put them in, and seeing all the videos. You go to YouTube for everything, and so you're looking at the videos on how to put them in and how comfortable they were. And as soon as he hooked me up with them, it was night and day. It was amazing. They're the most comfortable lens I've ever had in the 30 years that I've had to go to the eye doctor.
And you've been so you've actually been with him 20 years, so you've...
No, I've been with him for like the last roughly 4 years.
Oh,
I think
this
is their third set of lenses.
On your 20-year journey, I guess, is what kind of referring to.
In the journey that I've been.
You finally got
to the point where, I mean, he's amazing. I mean, it was because he fitted me well. He said, let's try this, and really it was spot on the first time. I don't think we've changed the lenses again after that. And
That's
it was
wonderful.
And it set everything in place. But I think the big thing is, like you talked about, it brings the curvature back into place. I had one doctor tell me it's kind of like you putting the hard lens on there to make an impression. And so it holds it in there, because when you take them out, you can't see a thing.
Difference.
And it's like Maria said,
well, you just sound like the savior over here. So it's been a pleasure. So where can people find you? We have to wrap up, but is it MyEyeDr?
Yes, www.MyEyeDr, which is MyEyeDr.com.
Okay.
And then from there, there's a search bar at the top where you can type in your zip code, and it will take you to our nearest location where we have fantastic doctors and eyewear consultants, and we welcome all insurances. So there's something for everyone on that website.
That is so great. I'm so glad to have met you and learned about it. And thank you, Steve, for kind of sharing your story.
Absolutely.
Sounds like it's made a great difference in your life.
Huge.
So yeah. Well, wonderful, guys. Well, thank you for being here.
Thank you.
Before we wrap up, it's time for our Golden Egg Weekly Raffle. This week, we have been generously gifted 4 tickets to a Christmas at the Big Rivers. You will enjoy a winter wonderland filled with lights, laughter, and holiday cheer for the whole family. So to enter for your chance to win, simply send us a DM on Instagram or Facebook with the word Big Rivers Christmas Adventure. And if you would like to be a sponsor on the Hatching for Health show, we would love to hear from you, and you can message our team at hatchingforhealth.org, or if you'd like to make a difference in our families in the community, you can also donate there to support our mission. Thank you for tuning in to another episode of Hatching for Health, and a special thank you to our new partner and sponsor, Dr. Way. I wanted to give you this.
Thank you.
With MyEyeDr. We appreciate your incredible support as well.
Absolutely. Thank you.
Thank you.